Her name was Marjorie Reynolds, and she was actually in her younger years, she was very outgoing. This is Mom. Actually, she's in her 50s, and she loved to laugh. There's pictures of her laughing. Mom was diagnosed on June the 12th with stage 4 lung cancer metastasized to the brain. And it was at that moment that, we had to start to figure things out. Trying to navigate the system with a terminal illness and end of life, it gets very overwhelming. And again, I can handle a lot of stuff, but there were a lot of times it was very, very overwhelming.
Denise came to talk to us and gave us a perspective on what it's like to be caring for a frail older adult.
I expected someone to sit with myself and my mom and say, okay, this is what we need to do. So your mom is here, and so this is the next step. But no one was doing that. No one knew what was supposed to occur any more than I knew. My mom kept saying to me, Denise, what do people do who don't have you, who don't have a you helping them get through the system?
When we're working in health system planning, it becomes a lot about overall numbers, evidence, words on a page. Denise made those real. Then it became about real people with real challenges, trying to do the best they can with what they have available. It made us just redouble our efforts to actually not just identify what we needed to do to improve, but actually make it happen.
People don't have the support that even Mom had from myself and my 2 sisters. And is it fair that even if there is that support, that we have to be the caregivers as opposed to grieving someone's end of life?
Our healthcare system was designed very effectively for a different population, a younger population. It was not designed to care for older folk who've got lots of different medical conditions, who require services that are completely different from those that the system was designed to give.
We are in the process of developing a 10-year older adult strategy.
We've been driven by the need to identify the way in which services are provided from the patient and caregiver's perspective rather than that of the healthcare provider.
We are redesigning a system that's taken years to build, so it will take us a few years to help put those improvements in place. It's an overarching strategy that's going to guide our work for the next 10 years.
I really feel that they heard us, they heard the story, and they listened to us. So I'm very grateful. So we had a really great relationship. Miss her a lot.